Hi, Dr. Yass here. In this video, I want to talk about a specific diagnosis which is given for people who have pain somewhere in the back or inadvertently when they're having sciatic symptoms, which is the exact thing that happened with a person that I just treated. And that is the diagnosis of Facet Joint Syndrome. This relates to the lower back vertebrae. And I just want to briefly point out that this individual who was seeking care was having sciatic symptoms, pure and irrefutable. They were clearly identified as sciatic symptoms. The person was complaining of pain at the upper gluteal region running down the back of the leg all the way to the foot. And it was incited one particular way by if he initiated bending forward, it would trigger the sciatic symptoms. So he had said he had been having this for months on end. He had seen multiple chiropractors. He ended up going into the usual route of seeing a neurologist or an orthopedic surgeon. They got an X-ray or an MRI of his back, and it found this, I guess, arthritic change at the facet joint of a couple of the lumbar vertebrae. And so that became his diagnosis, and he was getting facet joint blocks. And it wasn't doing anything. And the guy's life was really becoming crippled. And so he sought care. And I was able to show, based on his symptoms, which were irrefutably sciatica, we performed a series of exercises that the Yass method prescribes for sciatica. And with just one bout of doing 3 exercises, he was able to initiate bending forward without the sciatic symptom. Just before I had him test it and make sure that just barely bending forward, he could trigger the sciatic symptom down his leg. We did the exercises, one bout, because it turns out that sciatica is muscular in nature and it actually relates to hip dysfunction. It has nothing to do with the spine. And so by doing the exercises, I was able to show that we were able to stop him from triggering the sciatic symptom. But the reason for this video is that I don't think people understand what that facet joint is, and the fact that it's basically just a mechanical point where 2 vertebrae join together to assist in creating greater stability of the spine. That's its purpose. And basically, if you look at a lumbar or cervical vertebrae, you see the round portion of the vertebrae, which is the vertebral body, and then you have 2 prongs sticking out on the side and 1 sticking back. And at the bottom of a vertebrae where the 2 prongs stick out, there's this kind of undulating protuberance that sticks out under it. And then if you look at the vertebrae below that one, in the same spot on the 2 pieces sticking to the side, which are called transverse processes, you're going to see this cutout area. And so when the person leans back or arches their back, the protuberance on the bottom of the vertebrae on top sticks in to the portion cut out on the vertebrae below it, and it locks the 2 vertebrae together. That's its purpose. That's the purpose of the facet joint, okay? It's just there to enhance developing stability and the mechanism of tying independent vertebrae together in an extended position, because that's when the vertebrae are designed to create support of the back. When you're bent forward or hunched, the vertebrae actually kind of open in the back as the lumbar spine goes from an arch position to more of a hunch position. Those back of the vertebrae open, separating the facet joints. And therefore, you have the ability to twist and bend and rotate and all the other stuff. But once you go back to that arch position, the whole idea of those facet joints is to lock the vertebrae together. It is a mechanical locking of one vertebrae into the other. And its purpose is to create stability so that the lumbar spine can absorb support and transform force from the torso down through the pelvis to the ground. So typically, if we're talking about how is the facet joint syndrome identified, it's usually through an X-ray or an MRI, and it found some arthritic change. And since the arthritic change is found at the time of some sort of symptom, it is said to be the cause of the symptom. In this guy's case, you have to appreciate the lunacy of the system that is describing a facet joint arthritic change as the cause of sciatica. Sciatica is irritation of the sciatic nerve. There's no such thing as a nerve that attaches to the spine. Therefore, any structural variation at the spine can create sciatica. Nerves form away from the spine as the nerve roots that come out of the spine join together to create the nerve. So the fact that this guy was openly, clearly describing a sciatic symptom, and they're doing x-rays or MRIs to look at the lumbar spine to identify a cause, describes the complete lunacy of the system that's searching in a place where the cause can't be found. Then you actually have to go on and just say to yourself logically, if you want to tell me that this arthritic change at this facet where these two vertebrae stick together, join together when you arch your back, and when they're free to move when you bend forward or twist or anything else, where would you expect the pain to be if in fact the magical facet joint was the great pain? Wouldn't it just be at the facet joint of that one particular vertebrae? So if you're telling me that your symptom is anywhere other than at the location, at the height, where they're saying there is this arthritic change of the facet, and your pain is anywhere outside of that level, out away from the spine, other than at that particular location of the facet joint itself, you got to be able to explain how that pain could be coming from that arthritic change. And you can't. There's no such thing. It's just made up. It is this concept of finding a structural variation and simply asserting because it's found that when you're having any kind of symptom, that must be the cause. That is the lunacy of the system. So this guy went on and he had multiple facet blocks. He had this facet joint blocking thing, these injections, and they didn't work. So they were getting ready to go on and burn his nerves. And just by the grace of God, he happens to know somebody who knows somebody who gets him to get the Yass method. This guy told me he had spent thousands of dollars on treatments already, all based on this just clearly nonsensical diagnosis derived from an X-ray or MRI finding this arthritic change. And because it's found at the time of his symptom, which clearly couldn't have been coming from it, he has been going on for months of getting treatments, chiropractor and injections and pain medicine. Oh, and the anti-inflammatories, Meloxicam he told me he was on, which is destroying his stomach. You just got to understand. I'll keep saying it because I think over time, people will eventually recognize that this is just moronic. You can't be able to describe or identify the cause of symptoms by simply getting x-rays and MRIs which show variations to structure and just assert that it's the cause when the symptom is clearly, irrefutably not coming from the spine. I give these examples because I think almost every one of you out there who's suffering from pain is suffering from pain, chronic pain, for the very same reason. You're just being misdiagnosed because you're going to people who are incapable of interpreting your symptoms. You know for sure that any attempt to describe your symptoms is fully ignored by the medical system, and your diagnosis is 100% derived from the findings of an X-ray and MRI. This guy is the classic example of it. At some point, you've been in pain for months or years, you have to start saying to yourself, is the problem that I've been misdiagnosed? Not, have I got the right diagnosis and I just haven't got the right treatment? You could go on and on and on and keep trying to get treatments, but over time, at some point, you're going to have to, you, not the medical system, because this is their method and it's not changing. You're going to have to make that decision. Is it possible I got the wrong diagnosis by the use of X-ray or MRI, and that structural variation has nothing to do with the cause of my symptom, and it simply happened to be found or seen at the time I was having my pain because something else, like a muscle, was creating the pain in the area? There's your logic. That's what makes more sense. Not the structure is the cause, and somehow they just haven't figured out how to get me that right treatment. This facet joint syndrome is pure crap, meaningless nonsense. You got to have a little bit more knowledge, and I'm happy to provide the knowledge. You want to, if that's been your diagnosis, the facet joint syndrome, look up facet joint syndrome. See what it means. See what they're trying to say. See if it makes sense. If you look it up, they're going to just say something generic, like if you're having pain and this is found, then it's the cause of your pain. Or if you have difficulty bending, twisting, turning, and you have this found, it could be the cause. Well, a muscle in spasm or a short and strained muscle will limit you from bending, twisting, or turning, and it's going to elicit pain. So I don't get it. How did you differentiate whether it was muscle or the facet joint? You don't. You don't. That's the problem with the system. So I'm giving you the opportunity to understand these concepts. I'm providing theory, clinical presentation. I'm getting you to try to understand what the words mean. And from there, make the decision. And if you think that this has been an improper diagnosis and you're ready to interpret your symptoms, which is the only real way to understand the cause of the symptoms, then you get the Yass method. If you want the Yass method, you can get it by emailing me. If you want to discuss your situation, at Dr. Mitch at mitchellyass.com, Dr. Mitch at mitchellyass.com. If you want to look further into the Yass method, you can go to the website, livewithoutpains.com, livewithoutpains.com. Both will be in the description below the video. If you think that this is the answer and you'd like to make a Yass method Zoom session, you don't have to get it by being in person. That's not necessary. I live in Jacksonville, Florida, but if you're not in the area and you don't feel like you need to come, you don't have to be in the area. You don't have to get the method in person. You can get it by Zoom session by going on the website and scheduling a Yass method Zoom session through Calendly, and you can pick the day and time that's most beneficial for you. All you need in terms of treatment mechanisms is a resistance band and a chair to perform the appropriate exercises if it is confirmed to be a muscular cause, which I have shown it to be in more than 98% of cases, even after people have been provided a positive finding by X-ray or MRI. I'm telling you now, if you can't get to the point where you are willing to break away from the system that says that simply because the structural variation is identified at the time of your pain, it is the cause, then you can pretty much prepare for pain for the indefinite future. Please start taking responsibility for yourself. It is going to be your only hope of getting out of pain. If you like this video, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, and would like to subscribe, please do so to get notifications when new videos are added or when I am live on YouTube. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.